Today, we're tackling the big question on everyone's mind. Can AI actually make us better dentists? Today's guest is a true pioneer at the intersection of AI and dentistry. Florian Hillen is the founder and CEO of VideaHealth. And if you're wondering what happens when you combine an MIT computer scientist with a passion for healthcare, well, you're about to find out. He's also exactly the kind of innovator we love to feature on Dental Talk. Someone who's not just thinking about dentistry where it is today, but actively shaping where it's headed tomorrow. And the timing of this conversation could not be any better. With the recent announcement of VideaHealth's partnership with Dentalcorp, Florian and his team will be helping to enhance patient care across Canada's largest dental network. But today, we're looking beyond just our network. We want to understand what this technology means for the entire profession. Florian, welcome to the show.
Thank you for having me.
Let's start with what drew you to dentistry. What made you look at our field and think, this is where AI can make a real difference?
Yeah. Look, honestly, I sometimes say my entire life led me towards dentistry and AI. As you hear from my accent, I'm originally from Germany, and I actually was many years in medical school in Munich. And so in Germany, the first 2 years, you are very close also with dental students. It's not as separated as it might be in North America. And so I always had an affinity to dentistry and healthcare in general, having been in medical school, right? So I don't see there's a divide between the two, first of all. Secondly, then, when I was at MIT and Harvard, I did a lot of research in the field of AI in healthcare and especially imaging. So I did research on chest x-rays or on breast cancer detection. And throughout that research, I realized that in dentistry, we can have one of the biggest impacts of AI. And the reason why is that, a dentist has essentially 4 jobs, right? He's a diagnostician and a radiologist, a primary care physician, a surgeon, and a business owner all together, right? Versus a radiologist sits in the dark chamber all day, all night, and the only thing they do is looking at radiographs. A dentist has much, much more responsibilities. And so I started doing research with a hypothesis, can actually a dentist with AI versus a dentist without AI lead to better health outcomes for the patient, as well as, alleviate a lot of the burden and the time sunks for the dentist. And I think the research showed us, yes, absolutely. And so that's now many, many years ago, but I published one of the first research papers about AI in dentistry, and the health outcomes have been incredibly successful. So actually the improvement for the patient has been much, much larger than maybe even in other healthcare domains. And so I really fell in love with using AI in collaboration with the patient, with the dentist, to provide better care. And so since then, I learned more and more about dentistry, fell in love, and started the company.
So before AI and dentists were looking at radiographs and they're helping try to make diagnosis, can you share a moment when AI caught something significant that may have been missed by the dentist that AI actually picked up?
Yeah, look, I think dentists are really good at diagnosing overall. But at the same time, we all know that if we are in a hectic day, right, we are jumping from one operatory to another operatory. We have a full mouth X-series with just 18 different X-rays. And you have it on a small screen, and maybe the sun is falling into the screen and so on. It's really hard to take the time to go through each of the images, change the contrast, change the brightness, change the inversion to really check, okay, is that a cervical burnout or is that actually early stage decay, right? And so it's a huge time sunk. And what we've been seeing is actually that the AI is incredibly good at pointing out in a very consistent way, here are the areas of interest. Here's what you need to double click on. And so what the AI is really good at is it never gets tired. It never has biases, etc. And it will always consistently give you a prediction. What the dentist is then really good at is knowing the patient, seeing the skin color, seeing if someone has a fever or not, right? So really understanding the patient. And so this is kind of the synergy where the AI is great to be a scanning tool and a supportive tool. And then the dentist is incredibly good with all the knowledge of the patient, right? To do a holistic treatment plan.
So it allows the dentist to really catch things that he or she wouldn't otherwise have found because of their busy days and all the other external factors that they have as well. In simple terms, how does the AI think when they're analyzing X-rays?
Right. So you have to, so super quick, what is AI, if you don't mind, right? I feel like that'd
be great. I think it's a great place to start.
Yeah, exactly. Because to be honest with you, obviously I'm super excited about this field, but also with the explosion of AI everywhere, I feel like there's a lot of misunderstanding what it is. So AI is not a well-defined term, but the way how I could explain it best is that you have an input, you have the AI, and then you have an output. And the more data you have, the better you can train it, and the better is the output based on the input. So let me explain that. One AI would be, for instance, search, which, for instance, you use on Netflix. The input is your viewing behavior. Oh, I like Narcos or whatnot, and I loved all the season, and I even double watched the episodes. Then the AI has, from all the other 300 million plus users of Netflix, knows that if you like Narcos, you also like that TV show, and the output is a recommendation. And this recommendation, hey, you might like this show as well, becomes better and better the more data this AI system has. Right?
So it's always learning.
Exactly.
All the time.
It's always learning, and it learns in particular about getting more data, and then also knowing if they do a prediction, for instance, you should watch this show. When you watched the show and liked it, then it learns also to have a feedback loop. Does that make sense? So more data 100%. And a feedback loop makes the AI better. So how is this applied now to dentistry? So how we did this is that our input are dental X-rays, and then our AI is like a bite wing, right? And our AI system at this point is trained, hundreds of millions of X-rays. And with over 100 dental experts we pre-selected who are training the AI as well, okay? And so essentially you can think about our AI system that every time you are looking at a bite wing, that you almost have, 100 dentists who are dental experts looking over your shoulder, who in themselves have seen 50 times as much X-rays as a dentist would see in their lifetime. So you have like an incredible experienced dentist kind of supporting you and pointing out things. Hey, have you looked at this? Have you looked at this? And that is then the output of the X-ray. The output is the X-ray, and then with like the shades of the cavities of the periodontal disease based on the learnings.
Sure.
And the more data we feed into that system, and the more feedback loops we get, where we say, this is a cavity, and then later on we know, hey, the dentist actually did the treatment, the better we can improve the AI. Does that make sense?
100%. So let me ask you a question. As far as looking at a patient's X-ray from 2 years ago and looking at it today, and let's say no treatment was done, can you predict the progression of the disease and inform the patient what may happen so they have to undergo treatment as soon as possible?
Yeah, that is one of the things I'm incredibly excited about. So sorry that I'm answering this a little bit more holistically, this question.
Okay.
But there's actually a lot of research in breast cancer done about predicting breast cancer, right? Which would be obviously incredibly valuable. The problem you have in breast cancer and in general in healthcare is that you don't have a large set of continuous X-rays. Does that make sense? Because you only, for instance, get a chest X-ray when you have construction. You don't get a chest X-ray every year, right? In dentistry, the beautiful thing is that the large majority of patients are recurrent patients, and you're getting X-rays at a relatively regular pace. So that allows us, number one, to your point, when you use VideaAI, we automatically take the last 18 months of X-ray, or even longer, honestly, and then we can, run our AI on the X-ray from, for instance, 2 years ago, and we can show the size and the stage of decay. And then we can also run the same AI on the X-ray right now. And that helps the clinician to show retrospectively from 2 years ago to now how much the decay has grown, right? 2 years ago it was in enamel, now it's already in dentin, right? And then if you don't get the treatment now, in 2 years it might be in a pulp, and all of a sudden you need a root canal.
And then a core buildup, and then a crown.
Exactly, right? And so what our software does already now is exactly this retrospective analysis that we can show you automatically the stage of decay, the stage of perio, bone loss, for instance, from the past X-rays to the current X-rays. What we are actually doing research on right now is using all of that data. We are, just to give you a sense, we are roughly processing 500 million dental X-rays per year at this point, right? Using all of that training data, going back to the concept of more AI is better, or more data is better, to in the future, and we're working really hard on that we could even predict if you do this treatment, what's going to happen? If you do not do this treatment, what's going to happen?
Yeah, that's important. That's important for treatment planning, to inform the patient,
correct,
and to allow them to make educated decisions on the treatment that they're going to have. That's
right. And I'm also very passionate about this because, the one thing we learned always in med school, and I bet you agree with me, is it's not really the state of disease; it's really the progression of disease.
Of course,
right? Like that's really what you're trying to achieve. And so if we can show that, 3 millimeter bone loss is maybe worse than 4 millimeter if you had a year ago just 1 millimeter bone loss.
Correct.
Right? And it's maybe not stable. It's actually rapidly increasing and you want to catch it right there. And our mission at VideaHealth, really, and that always comes back to the mission, is to support dental clinicians, the dentists, the hygienists, the front office staff, to provide easier and better care to their patients through AI. And so if we can help to catch diseases earlier, show that this actually has a rapid progression, and can convince and support the clinician that the patient gets the treatment now rather than delaying the necessary treatment, that's what we count as success.
Right. And prevention is key. So
100%.
Building trust through AI-centered communication, impact on case acceptance. Can you relate maybe a patient success story?
Yeah, I mean, we have really many, and it's kind of beautiful because we sometimes get like unsolicited emails, like not from dentists, we get that as well, but also from patients who are sharing that. To be quite honest, one patient story is even from myself. So, I'm probably radiating at this point because every time I'm going to a city, I'm trying to find a dentist who uses our technology, and then I'm just like sneaking in as a patient to see how they're using it and all of that. Yeah, exactly. So I've had a lot of dental X-ray
secret shopper.
A little bit, yeah. And then in the very end, you're like, "What do you think about this AI?" And they're like, "Anyways, it's a good thing." Actually, in fact, we have a company policy that we reimburse our employees, and everyone goes to what we call AI-powered dentist.
Oh,
that's so amazing. Everyone goes to an AI-powered dentist, and then they share all the findings. And quite honestly, that's where a large majority of our innovation comes as well.
And how are patients responding to AI? Are they positive? Are they a little bit skeptical?
Right.
Is it kind of futuristic for them?
Yeah.
How are they responding right now with it?
Yeah, I mean, incredibly positive, really. Because if you have the choice to go to a dentist, or you go to a dentist who also has this second ad hoc opinion, it just increases, number one, the transparency in this communication, as well as we spent a lot of time on improving our visualizations. So it makes it much easier for the patient to understand, oh, wow, like the dentist is not trying to sell me on something unnecessary, but instead I really need to get this treatment. So it does increase the trust of the patients. So let me give you an example.
Okay.
And that actually happened to myself. I was at one of those dentists and they said, hey, you have early stage decay in the enamel. If we don't do now fluoride or Curon or whatnot, this soon will be a filling, and so on. And me who has been in dentistry now for over 6 years, and really tried to learn the material, was starting to argue with him about the gray dots, if this is really gray or if this is just like cervical burnout or what it really is. Does that make sense? 100%. So I started arguing, and then he weaponized our own product against me, where he just said, well, look, these FDA approved and also Health Canada approved AI algorithms,
right?
Trained on hundreds of dentists, 50 times as much data as I ever see in my lifetime, also picked it up. And then we have a visualization where you show the outline of the decay for the patient view, and you can see exactly how far the decay goes into the dentin. And the enamel, and it totally made click to me. Shit, I really need to do something about it, right? And so this visualization is incredibly helpful to increase trust, but then also the right sense of urgency, if that makes sense. Because more often than not, a patient just says, let's wait, right? And the problem is what we are seeing in our data, Gary, is that more often not, if they wait, it becomes worse.
Right.
You would be surprised how often it actually becomes worse.
So now that you have all this and you can predict the progression of the disease, are you finding that the patient acceptance rates are higher now to undergo the treatment that's recommended?
Yeah, absolutely. I mean, we actually did a case study where we analyzed 470,000 patients, which were diagnosed and treatment planned with the support of AI and without the support of AI. And what we identified is that the overall production, meaning how much was diagnosed and then also accepted, right, by the patient and led actually to the treatment, was increased by 12%.
Well, that's impressive.
Yeah, it's really magnificent. And that study was, by the way, across crowns, fillings, and scaling root planning procedures, so periodontal treatments.
So comment on the concept of ROI. I know you like to talk about ROI in two ways. Maybe you can discuss that for us.
Yeah, and I appreciate you teeing us up, and we know each other a little bit already, and so you know how I love to talk about ROI. ROI, return on investment, is obviously a very important concept in dentistry because every one of your listeners has to run a business, right? What I really like to emphasize is there are two types of ROI. There's the clinical ROI and then the financial ROI. On the clinical ROI, to the point you just mentioned, we really see a huge increase in what we call number one, diagnostic rate, meaning that you identify disease earlier. By the way, up to 5 years. We identify the dentist with the AI identifies early stage caries 5 years, sometimes earlier than other dentists. And number two is on the case acceptance. So the clinical ROI is that we enable patients to get the right treatment at the right time and not delay necessary treatment. And I think that's incredibly important. That also comes though then, fortunately, with a really great financial ROI, right? Because instead of the patient saying, maybe let me think about it, leaving the office and you never know if they return or if they move or whatnot. Instead, we just see that, that they are doing at a much higher rate the necessary treatment at that point at that dentist. And so with that also, we do see that, an office makes, quite a lot, like over $80,000 more per year just by implementing.
Well, that's significant. So the dentist benefits, the patient benefits by getting quality care, but the patient also benefits another way in that they'll probably end up spending less money getting the treatment a lot quicker than if they waited for more expensive treatment that may have to be done because of the wait.
That's absolutely true. And, that's why I was, when I founded the company, I was like, okay, with my healthcare background and then AI, I really wanted to find something where I can put where we can all be super proud of what we are building. And quite honestly, I think there are some AI technologies in other spaces, not dentistry, where they do take jobs. Like there's not such clear win-win. This one here, dental AI, and what we work on at VideaHealth, is a beautiful win-win-win situation. A win situation for the provider. It makes their job easier and they have clinical and financial ROI, but also a win for the patient. That much, by the way, that, as I mentioned earlier, in my company, everyone now goes only to an AI-powered dentist because why not, right?
No, sounds like it's good. They're going to get a better patient experience and ultimate better care, hopefully.
That's right.
Right.
So, and again, I would always choose a filling over a crown. I would always choose, a crown over a root canal. I would always choose, a cleaning or like a scaling root planning procedure over a surgical, right? So you do want to diagnose and treat dental disease as early as you can.
Now, when you talked about FDA and Health Canada approved, something I've always been interested in, when you set the sensitivity and the specificity levels with respect to what it can detect, are there certain levels that are required for FDA and Health Canada approval?
Yeah, absolutely. I mean, it's very important that you show in clinical studies. Anyway, sorry, let me move back. There's a misconception. I want to say that first, right now in AI domain, that it's the AI versus the expert. Does that make sense? The AI versus the marketing person, right? And so on. That is not true in healthcare. In healthcare, and that's what we have to show for instance, FDA studies, it is the dental clinician compared to the dental clinician with AI needs to show that across different statistical measurements, that the dentist, together with the AI, has a higher diagnostic accuracy than without the AI. Does that make sense? And we measure that in two major dimensions I do want to share. One is sensitivity and one is kind of specificity. So that means that of all the true decay that is there, does the dentist identify more true decay with the AI than without the AI? And then in specificity, of the things the dentist says this is decay, with AI, do they have less errors, less diagnostic errors? And so we need to show all of that.
And the answer is for both?
We are very fortunate that in our clinical studies, we showed on both sides that we significantly reduce the missed decay, but then also that for several types of decay, we also reduce the false positives. That's what's called. Exactly.
Right. That's amazing. Yeah. So another question I have, when clinics start to implement AI, what are the biggest challenges that they find?
I think it's, as always, change management, to be honest, right? And what do I mean by change management? That's such a consultancy word, right? What I mean by that is that as a dental clinician, a hygienist, a dentist, front office staff, you have so much work. You have such a full schedule, and you just figured out how to use Tracker or Dentrix or whatnot, and you know how this goes, and you have so much other stuff to take care of. So you really don't want to have another tool, another button, and so on, right?
Of course.
Exactly. We all feel the pain. I feel the pain. Even when my IT team tells me, hey, we don't use Slack anymore, we use Teams. I'm like, don't get me started, right? So doing change management is, I think, the most important aspect. And I think the one big advantage we have is that everyone is already used to using X-rays to diagnose, treatment plan, and case present, right? And so the only difference now is that we are doing this X-ray analysis, plus we have AI overlay. So the good thing is how to use the product is actually very intuitive. It's actually more intuitive than the majority of other products you implement in your clinics. Let that be patient engagement, business intelligence, whatever other products you have. VideaAI is actually more intuitive than that. But where we have to focus on is that we explain to the clinicians how to use it in their workflow of like diagnosing and case presenting. Does that make sense? Because really, when you use it that way, then you become all the benefits. I think that's the one aspect. And then the other aspect is quite a lot, and that's why I love these podcasts, just educating, right? Because, and I think actually ChatGPT and all of these AI methods, they're really helping us to educate people that AI is not a God which knows it all. AI is a statistical aspect where it is really good at certain things, but it will also have always some errors, some what we call false positives, or it will always miss some cavity. So it's not perfect, right? But if you understand that and you understand the strengths and weaknesses, then together you can have a much better outcome.
So with respect to the change management,
right,
it's a real team approach, isn't it? It's a team approach between hygienists and dentists. I know I'm very busy. Most of the doctors, dentists I know are very busy as well. And just like you said, it's hard to find time to carve out and learn that. I see it, in my opinion, and you can even reinforce it or refute it, that setting everything up when a patient is in the chair with a hygienist, for the hygienist to set everything up, have everything ready for the dentist. When they walk in, they can just talk to the AI and talk to the patient and present it a little bit more fluently and better case acceptance, in my opinion.
That's right. And let me double click on that. So we are in a fortunate position. I mentioned earlier, our division of my company is to be the first AI company to diagnose 1 billion people globally. That's our goal.
Where are we at now?
Well, we are at tens of millions.
Tens of millions.
Several tens of millions.
Impressive.
We have. We are right now at over 30,000 dental clinicians using our platform in North America.
Wow.
And we do several tens of millions of patients per year. And several hundreds of millions of X-rays per year. So we are getting there, but 1 billion is still a way to go. But we've rolled it out across really 30,000 plus clinicians, and now we have and are rolling it out right now across Dental Corp, right? And
so you just added another 2.3 million patients.
Exactly, and thank you for joining this mission. No, really, we really we sent every one of our partners really, that you're part of the vision. We actually have T-shirts, by the way. We created first 1,000 patients, million patients, Amazing. 10 million patients.
Can't wait to have my series of T-shirts.
Exactly. But we really do have that. It's kind of funny. It's on our office, because everyone joins that mission, right?
Sure.
And the last piece, why is this relevant? I do want to make that point. We do know from our FDA studies roughly that every second patient we support in the diagnosis, they will get an earlier treatment plan and will accept a treatment which otherwise wouldn't have happened. So that's how I measure the impact of my life, honestly, and also this company, that if we do 1 billion people, we know that we have helped 500 million, if that makes sense. But to your question about the change management, throughout this deployment, we have learned what you said is absolutely true. The best practice in every dental office is different. But really, hygiene and hygienists are our absolute champions. Why is that the case? To be quite honest with you, in North America, roughly 50% of adults have periodontal disease. If you look at the data, and that's like really striking, the data in the dental office, how many of the patients are actually getting periodontal treatment? What do you think? What is this?
The percentage?
Yeah.
Don't even know. You tell me. You have that answer.
It's sub 10%.
Really?
Yeah.
Amazing.
So you see there's a gap of a minimum 40%.
Huge gap.
Exactly. Of patients who should get periodontal treatment, but they do not. And I think because, it just is a recent shift that I think also insurances and so on, they understand what is this big impact of periodontal disease to overall health, right? To diabetes, hypertension, you name it. And so what our AI does really, really well is, in Bitewings PAs, you name it, that we measure automatically the bone loss in millimeters, right? And we color code it, green, yellow, red. And it makes it incredibly easy for the hygienist to identify in which quadrant there is periodontal disease, but then also to convert it. So periodontal treatments go up significantly after the implementation of VideaAI. And again, this is a win-win, right? Because me as a patient, I definitely want to get my perio treated. And so that makes hygiene and hygienists incredible champions of the software. So they are using it the most, to be honest. And then when the dentist comes in, right, and has just little time, it's already, to your point, is already prepared. And the dentist then spot checks all the cavities, for instance, and makes crown recommendations or fillings or whatever the perfect treatment plan would be. And that is really the best practice. The hygienist is using it, is preheating the patient on the perio, on also other diseases. The dentist can come in, they have one voice in front of the patient, and they can convert the treatment.
So it's interesting that you brought up the Oral Health Systemic Health Association, where that's where things are going right now. So not only are we improving patients' oral health, but we're also improving their systemic health as well, which is really a real big boon. You mentioned diabetes. We know oral inflammation can exacerbate diabetes. And if we can control that and look at the progression over time in a particular patient or patients, then hopefully we can get a healthier population, less taxing on the health system as well.
Look, don't get me started on that. Coming from Europe, I think one of the things which is, and always will be disturbing to me is that there's a notion of there's dentistry and there's healthcare. It's all the same. It's all healthcare.
It's all the same.
Right. And what I would love to say is I don't know if you know this fact, but roughly in North America and in the US, 4 cents of a dollar are spent on dentistry, 96 cents on the dollar are spent on healthcare. Right. If you look at the 96 cents and you take cancer out of it, you will see that the large spending is on chronic diseases such as diabetes and hypertension. What the vision of VideaHealth is, and by the way, this is where the name comes from. VideaHealth means videre, to improve overall health.
Oh,
yeah. So no one really knows that, but there's a thought behind the name.
I like that. I love that.
Exactly. Yeah. Our vision is that we make VideaAI the standard of care. And what I believe we will see is that the 4 cents will significantly reduce hypertension, diabetes, and reduce the overall healthcare cost. So I want the dentist to become the screen for the primary care physician.
As it should be.
As it should be.
Because you see your doctor, if you're lucky, maybe once a year, if you're really diligent, because you go for your yearly exam, but you see your dentist twice a year, maybe 4 times a year.
And what you are saying is supported by statistics, by the way. It is very obvious that a much larger percentage goes to the dentist regularly because also cosmetic reasons, right? And so you regularly go to that, and that's where we hope to catch, to catch early onsights of overall medical issues, to flag that early and catch it earlier.
Amazing. So you're an innovator. What capabilities are you excited most, moving into the future with respect to AI?
I mean, so many. But I think the one, maybe let me categorize that. The first thing I'm excited about continuing our journey on better clinical care. We've started with X-rays. We are going into all AI, into 3D. There's, orthodontics, implants. There's a lot of aspects we can support clinical AI and earlier diagnosis and better diagnosis. That's one aspect. And quite honestly, we touched on two aspects I'm excited about in that domain, and that is predicting disease, as well as medical dental integration, or how I like to call it, dental medical integration.
Mm-hmm.
So I think that's one aspect. The other aspect is that one of the biggest problems we are seeing with our partners is staffing, finding highly qualified people who want to do the job, right? And also still have a work-life balance. And I think we looked at all the administrative tasks in the dental office, and we do believe that we can, with AI, we can automate a lot of these administrative tasks.
Mm-hmm.
And that's the second bucket I'm incredibly excited about. Because imagine a world, Gary, where you don't spend 50-60% of your time in the back office writing doctor notes, trying to file claims, you name it. But instead, that's all automated.
Mm-hmm.
And you can spend more time in the front office with your patients, building the relationships, doing the treatments, building your client base. And that's why I'm excited about too.
And when you do when we have to do pre-authorizations, you can package it up. You have the radiograph, you have the photo.
That's right.
And you have all the treatment plan that needs with the codes. And
That's right.
It's just a package that can be effortlessly sent to the insurance company, freeing up administration time and getting answers back from the insurance companies really quickly.
That's right. That's
amazing.
Right. Yeah, so, and that's by the way the first of many things we are doing and we are going to do. That's the first thing it takes to get this all packaged together. It takes like 25 minutes or something like that, right, for front office stuff. Mm-hmm. And now we do this all automated in one click.
One click, amazing. Yeah. So how much time we're saving as far as front end staff, and you can concentrate on patient management as well. Yeah. So there are a lot of cynics. There's non-believers. What's your message to dentists that are hesitant to incorporate AI into their workflow?
Yeah, I mean, I think my main message is that this is truly not anything to substitute, replace you, or is better than you. Mm-hmm. It's a supportive tool that works with you and not against you. And again, I do believe that sometimes the AI buzz in other industries is not helping, because there are other industries where it's a little bit different. Mm-hmm. Call centers or customer success, right? In dentistry, it's really a supportive tool. And so what I would tell everyone is like, just give it a try. It will make you faster. It will make it easier to communicate with dentists, but it will still and always, and that's very important to us, will leave you 100% autonomy of making the treatment plan you think is best for your patient. If that makes sense.
Amazing. So in closing, this has been so informative. In closing, what's the one message that you can leave with our listeners today that would make them turn the corner to incorporate AI into their practices?
I think the one thing, and maybe that's not so practical, but I find it very exciting. I've spent a decade in healthcare before going into dentistry. And dentistry has historically been a decade behind healthcare when it comes to anything, technology, you name it, honestly. I think that dentistry will actually lead the way in AI. We have seen the fastest adoption of AI across the US and now Canada. Mm-hmm. And I believe that in 5 years, everything we just talked about, that dentistry will actually be 10 years ahead of healthcare. And that's what I'm super excited about. So I want people to lean in, be part of the mission, go on our website, join DentalCorp in order to participate in that new revolution, really.
Amazing. Well, Florian Hillen, innovator, pioneer, you're an inspiration to all of us. Thank you very much for providing such a valuable tool for dentistry and catapulting us to the future. Thank you very much.
Thank you so much. Thanks.